Hello, my name is Essie. I'll be your student nurse today. I have some doctor orders to put in a Foley catheter for you due to you having urine retention, meaning you're not getting rid of your urine like you're supposed to. Can you tell me your name and your date of birth? Thank you. This is my patient, y'all. My imaginary patient. So patient told me the name and date of birth. Are you allergic to iodine or latex? No? Okay, great. So first things first, I would wash my hands and provide privacy. I would put on regular gloves and get my patient in the butterfly position. I would also make sure they're comfortable, and I would pull back their cover. Pull back their cover, put them in the butterfly position. This is also my bedside table with my foliage on. All right, so what I'm gonna do is I'm gonna step over here. The Foley is unraveled because we used it so many times, but we're gonna make the best of it. So I would take it and take it away from me. Open both sides, and I will open the one farthest to me. Then what I do is scrunch this up. Right here, pinch this. And this like this. So I will lay it. I'm gonna pull this back a little bit more. It's a little bit difficult because I don't have a real person right now, but I would lay it as close as possible to my patient. And if I didn't like how it was, I would come underneath their legs and scoot it a little bit further. All right. So this is considered trash. Okay, all right. So now I would put on my gloves, and by placing my gloves right here because I don't have enough room, I broke sterile field. So if in reality I would start all the way over. So now I'm just gonna push this up a little bit more, push this back. Just for the purpose of the video, I wouldn't do this in real life. I would be starting completely over. And this glove wouldn't be in a package. All right, now I'm going to open up the gloves. Almost broke. Here. All right, I'm now sterile. I will open up my Q-tips. Open up my Q-tips. Connect my syringe. Apply my jelly. All right. I'm ready to go. No, one more step. Since we use this Foley, it would actually have a little shaft on it, so I would carefully take the shaft off without contaminating the Foley. Also, this Foley balloon is broke, so I'm going to say that I'm gonna push it up to 10 cc's, okay? All right, now I'm heading to the bed, placing this in the center, placing my non-dominant hand on the patient, open it wide. So now I'm going to go to the outermost part, trash, the side that's closest to me, trash, and down the middle, trash. Now, all right, so I will dip my Foley inside jelly. I will tell my patient to bear down, and I will insert until I see urine, and if I see a flash of urine, I'll go 1 to 2 more inches. 1 to 2 more inches. Now I'm gonna clamp, and if it was a male, I'll go 3 to 4 more inches. All right, now I would inflate my balloon. I would inflate my balloon, disconnect my syringe. I would do a small tug to make sure it's in place. All right, it's in place. That's trash. So now I would disregard my gloves, get some new gloves. I would then hook my Foley up to my patient's leg with the device, and I would hang this on the side of the bed that is non-movable. Now it's hanging on the side of the bed. I come back the next day, I introduce myself. I tell them that I'm going to remove it because I have a doctor order to remove it. First thing I'm going to do is release the urine from my Foley so it won't go back into the patient. Then I would release the air out the balloon. Sorry y'all, I know this kind of janky, but I'm doing the best I can. All right, I'll release the air out the balloon, and then I would tell the patient to take a deep breath, take it out, inspect the tip of the Foley, make sure it's no blood, no breakage, and no infections that look. And also I would actually perform hand hygiene before I take it out. And that's it.